everybody, I'm Stephanie. I'm with 9 Health. This is Health Happens, our weekly Facebook Live show that we do every Tuesday. And I'm joined today by Dr. Michelle Tollefson and Jeff Egan, who's a physical therapist. We're at the Wellness Place at the UCHealth Cancer Center in Fort Collins on Harmony Campus. We're going to kind of talk about what happens here and also talk to Michelle about her breast cancer journey. So newly diagnosed, newly treated, started going through the whole process now of recovery. We actually talked to Dr. Tollefson a few months ago, really. It wasn't that long ago, because you're a professor at Metro State in the lifestyle medicine program. You're a physician, formerly practicing as an OBGYN, so you have lots of knowledge as a physician as well.
Yes.
And then you came to us and said, now I have breast cancer.
Yeah.
Please tell my story. So why did you want to kind of share your story?
Sure. So I had a normal screening mammogram when I was 41, and just put the reminder in my phone, do another screening mammogram next year. And so I scheduled my appointment. And a week and a year later went in and went from a completely normal mammogram to
and I have that image.
BI-RADS 5, which is a not so good mammogram.
If you can see it, so this was Michelle's mammogram just last year.
Yeah.
And then a year and a week later has that mass appearing on her mammogram.
Yeah. And I'm a gynecologist, so I've spent over 2 decades doing breast exams, clinical breast exams, and this was a mass that I didn't feel, had no symptoms, and still don't have any symptoms, and it was a complete surprise. I don't have any significant risk factors, so it was just my regular annual screening mammogram that caught this.
Right, and Jeff, you're a physical therapist here at this wellness place. Michelle's here, getting treatment, receiving treatments. Talk about what goes on here, because it's a pretty unique setting, unique place with a lot of different people you can see as part of your cancer treatment.
Right, so it's a rehab setting that is dedicated to treating oncology patients, which is fairly unique in itself. It's a multidisciplinary approach, so we have physical therapy, occupational therapy, speech therapy, acupuncture, integrated medicine is located here, genetic counseling, massage therapy, and we have oncology-specific registered dietitians here as well.
Which is awesome, because when you get a diagnosis, I think I'd heard from patients about how many appointments you have, but until you actually experience it, and it's like, oh my goodness, but I have 3 kids. I have a 3-year-old, 6-year-old, and a 14-year-old. I work full-time. I teach students. I volunteer at the clinic seeing patients. Like, how do I work this into my life? And so having it all in one place, where all of the providers are communicating with my oncologist, Dr. Scott, and my surgeons are right here, my physical therapists and the dietitians, like everybody, you just feel like you have this team that is ready to go on this journey with you. So that's what I think I didn't realize. As a physician, I knew about these things, but until you actually are in it and in that, oh my gosh, like my life was normal and now I have this invasive ductal cancer.
And then as someone who teaches lifestyle medicine, which is the evidence-based approach to showing that diet, exercise, all those things really do help with our health, help with prevention. As someone who does that, were you surprised or not to see that this center kind of exists with all those kind of supplemental treatments that you can get, like acupuncture and massage and things like that?
So yeah, I knew that there were resources, but I guess I didn't know the strength of the resources. I didn't know. And I know, like, I teach lifestyle medicine. I know exercise is strong. It's potent medicine. It's good medicine. But to have the exercise equipment right here, I was just working out with the program that Jeff showed me. So to have all of that right here, just down the hall from my oncologist, just down the hall from the oncology counselor who I'm going to see later today, because this is stressful. And at first I was like, I've got this under control, and then you start to think, how am I going to do this? I want to keep teaching. I love all the projects I'm doing. So having it, like the strength of the support has been incredible.
And again, if you're just joining us on Facebook Live, we are at the Wellness Place at the Cancer Center at UCHealth Campus, the UCHealth Harmony Campus in Fort Collins, talking to Dr. Michelle Tollefson, who's recently gone through this whole breast cancer journey, recently diagnosed, started her treatments, now starting her recovery, and with Jeff Egan, who's a physical therapist here. We're talking about exercise, preventing cancer recurrence as well, all those kinds of things, but also just Michelle's journey. So you're a physician yourself, you teach, you practice too, that healthy diet, healthy lifestyle helps prevent things like cancer. So talk about getting your diagnosis. You're a healthy person.
Yeah, so I was honestly shocked. I had my screening mammogram and went along my day until I got that call. And then, as a physician, I was able to look at the mammogram and knew. And so I was not surprised when it came back a grade 3 invasive ductal carcinoma, stage 2. And so everybody's journey is so different. And I think that's one of the things that's wonderful about having so many modalities to choose from, and I was like, I want them all. If there's evidence behind, exercise, I want to use this as an opportunity to improve my upper body strength, which was not impressive when Jeff tested it. But I want to use it as that's my baseline. It's going to get better. So I wanted to use this as an opportunity. Like what can I do to improve? Because I already thought I'm pretty healthy. I exercise on my recumbent bike 30 minutes a day, and I eat really healthy.
Right.
And I know about a lot of stress reduction techniques. But then when I met with the integrative physician, Dr. Goodman, he said, "So you know about them, but how often do you practice them?" And so I think that we can use these diagnoses, whatever they are, hypertension, cancer, fibromyalgia, we can use them to kind of re-examine wherever we're at, whether thought we were healthy before or not, and decide what we want to do to kind of use this as an opportunity to get creative and say, what do I want for my health? Okay, so I know I should be doing upper body stuff, but I've been too busy to do it. Okay, so now I want to make that a priority. I've been eating healthy, but now I want to eat healthier. I went and talked to the oncology dietitians, and it was like, what can you teach me? I already thought I knew a lot, but what can you teach me?
Right.
So yeah.
Right. And then the exercise piece of it too, Jeff, kind of talk about the importance of it, in the recovery after having surgery for breast cancer, any kind of cancer, kind of the importance of physical therapy and recovery, and then also just preventing recurrence, or, for someone who hasn't been diagnosed with cancer, exercise can also just lower your risk.
Sure.
You can obviously still get it, but lowers your risk.
Yeah.
Right. So it's all about risk management, and depending on the studies that you read, you can reduce your risk of recurrence anywhere from 30 to 50% with moderate intensity exercise. So it doesn't have to be this high intensity commitment.
Yeah, talk about what moderate means.
So moderate intensity would be walking at a moderate pace, maybe increased heart rate and respiratory rate, but you can still easily carry on conversation. So the American Cancer Society recommends 150 minutes of moderate intensity activity a week, which is 30 minutes 5 times a week, which is really not that much.
Yeah.
And even that small amount can reduce your risk of recurrence.
Yeah.
Right.
But fewer than 30% of the general population is doing that much.
Right.
And then after diagnosis, it drops to below 20%.
Yeah.
So it's
Because
available.
it's hard. It's a hard thing to.
Making lifestyle
Well,
change is difficult. but-
It is. But that's where having this support, I met some fabulous women this morning who I'm excited now to come back and exercise with every Tuesday and Thursday. And I know if I had to do it on my own at home, especially, I start chemo this Friday, and I had my mastectomy a few weeks ago, and I had my first reconstructive surgery Thursday, and so I may not feel like exercising. But
Right.
knowing that the people who I met this morning will be here, who are already giving me great tips on some cool scarves and things like that they're going to be here. And that it doesn't have to be crazy hard. I would not choose to go out and run. I used to tell people the only time I run is if somebody tells me that a baby's going to deliver and I need to run to that delivery. But otherwise, I don't inherently enjoy exercise. But then when I get on the bike or get on the equipment and I start doing it, I feel better, and I know that those numbers, and so it's finding the right environment, and that's why I think it's so great that we have Jeff and the team and the center right here.
Right.
And
Yeah.
that's a big deal. I think the other thing people are aware of, lymphedema or problems with mastectomy and reconstruction related to cancer care, but they don't recognize that cancer-related fatigue occurs in upwards of 90% of people going through cancer treatment. Significant fatigue.
Right. Is that from radiation chemo, or is that just?
It's
the whole
it's
process?
multifactorial. It's from the disease process. It's from the medications, from the surgeries, the stress, sleep interruption, activity interruption. All those things contribute to fatigue, but there's piles of good research that the best non-pharmacologic intervention for fatigue is to exercise.
Yeah.
Moderate intensity exercise has been shown to be very effective, both cardiovascular fitness training and strength training, and that's what we do in our cancer-related fatigue exercise program that Michelle started. So we have that program that runs here on Tuesdays and Thursdays. We've been doing that program, honestly, for 11 and a half years. So it's been around a while.
Yeah.
Yeah.
Yeah, and Michelle, just kind of take us through, you talked about, you contacted us and wanted to share your breast cancer story. Just take us through kind of what you've gone through so far. So you haven't started chemo yet, but you're proactive. You already wanted to just shave your head and put on the fabulous scarves and kind of just embrace it all. So talk about, I guess, your journey so far and kind of how you've tried to regain control of the whole situation.
Yeah, so for me, I knew I wanted to use everything conventional medicine has to offer. I'm very evidence-based, and so I'm using the chemotherapy, and I, looked at my different surgical options and chose a mastectomy. So I'm using all that conventional medicine has to offer, but I also wanted to optimize what lifestyle medicine has to offer. So nutrition, physical activity, all of these different things. I wanted to use that, kind of take it to a new level. And honestly, what scares me the most about chemotherapy is the fatigue. And I think you mentioned, or someone mentioned, that it's more bothersome or than the pain, right? Or nausea and vomiting for many patients.
Right. So the NCCN guidelines would indicate that fatigue is the most common complaint, more so than pain or nausea in the cancer population.
Yeah.
Which is, when I first read that statistic, it surprised me that it is a significant factor. And so that's why we have patients in our exercise program at all phases of treatment. Fortunately, I love it when people show up beforehand and kind of get that routine in place, but we see people all the way through chemo, people that have completed chemotherapy, and for even my patients who have late stage cancer that's not going to go away and they're going to be on treatment indefinitely, they come in the gym and can continue to build strength and minimize their fatigue, which is all about quality of life, right? That's why we're treating the cancer, so that you can go do the things that you want to do. Yeah,
I have a 3-year-old and 6-year-old sons and a 14-year-old daughter who's helped me pick out some fabulous scarves. But yeah, like I still want to carry on going to the pumpkin patch with my 3-year-old this weekend if I can, even though I've had chemo. Like I still want to do all of those things, and so I wanted to share my story because I felt like I have the perfect example of why people need to get screening mammograms. As a physician, as a GYN, so often I would be like, okay, you need to get your annual mammogram, and there's some different guidelines and recommendations, so it is somewhat, it can be somewhat confusing, but I always, I hear from some women like, well, I don't have symptoms, and so this is the perfect example. I had no symptoms.
Right.
Well, I don't have risk factors. I exercise and I don't drink a lot of alcohol, and it's like, I did those things too. Or I don't have a first degree relative. Yeah, and so I don't have any first degree relatives with breast cancer. And so I was like, this is like what I've been talking about. Never did I think that I would get it. But really 1 in 8 women, at first I was like, why me? But then why not? 1 in 8 women will get breast cancer during their lifetime. And so I thought, if I can show people, like, get out there and get your mammogram. If you're over 40 and it's been a year, I'm part of the American College of OB-GYNs, recommend for most women that they do annual mammograms. So reach out, get your annual exam, do all of your screening, get your mammograms, because mammograms truly, truly, truly do save lives. Like I can't even think if I had waited 2 years. I mean, this went from being a perfectly normal mammogram on the 3D to 2.5 centimeters, and it was against my chest wall and hiding behind the nipple, so I wasn't able to feel it.
So I think you can see it. This is Michelle on just last year on the right, and then this year, just a year and a week later, with that mass.
So I was like, this is what we tell people. Not everybody has symptoms. Not everybody has risk factors. Like, get your mammograms. And so that's why I was like, can we use this to do some good? And then also, when working with patients, what I teach at MSU Denver, and what I try to teach patients when I volunteer in the clinic is, use your diagnoses, use whatever life deals you in order to get creative and to try to make whatever you're going through as enjoyable as it can be, and as kind of like use that diagnosis as empowerment in order to get fun pink shoes. I don't know if you can see them or not. Fun pink shoes. I needed some new pink shoes, and I guess like to try to see the silver or the pink, right? To see the silver lining or the pink lining in what you're going through, and use it as a motivation to get healthier, eat healthier, manage stress, and all of those things.
I'm just amazed at how positive you have been and how you are using it to kind of empower yourself and just share your story so that others can kind of see, what this journey is like if they don't know, or, just, that reminder that women need to get out there and take care of themselves and get those mammograms.
Yeah, self-care.
Right. And if you have any questions, I didn't say this, but if you have any questions, you can post those. Are we getting any questions, Kelly? Anything that we should share? Okay. And I wanted to ask both of you, kind of before we sign off here, and, this is good for Jeff and for Michelle since you're going through this now, but is there anything you wish that someone newly diagnosed knew about their upcoming cancer journey, or kind of what's in store for them before they come into treatment? And I didn't give them this question ahead of time, so I'm going to make you think about it. But
well, I'm the exercise guy, so I have a bias toward that, but I would say don't be afraid to ask questions, because there are side effects of treatment, for example, that people don't always think about. For example, with women being treated for breast cancer, frequently they may have, because of some of the hormonal changes of the treatment and medications, they could have pelvic floor issues.
Right, yeah, we talked about this earlier.
Right.
And that's surprising to think about a pelvic floor issue when you're dealing with breast
And
cancer.
people don't usually associate those two things. So if you're having symptoms that don't seem normal, don't ignore them.
Right.
Ask your provider. You may feel silly asking the question because it seems like it's a dumb question, but this is your first time through cancer. This is what we do for a living, so do not be afraid to ask a question. If it's related, we'll tell you it's related. If it's not, we'll tell you that it's not. But
Right.
I would say that it's a lot of information to take in. On average, there's 100 appointments in the first year after
Right.
diagnosis. Don't be afraid to ask questions.
Right, which here at UC Health, they have those navigators, right, that kind of help you through that process of hundreds of appointments right off the bat.
Yes,
and
yes,
Getting
yes.
in really quickly.
And also questions like when I first got diagnosed, I think my first question was like, how do I tell my kids? Like, how do I need my family to be okay. I have an amazing supportive family, but how do I make sure that they're okay through this too? So they've been there with all of the questions and the support. And so I think too, like I would tell people, find your community, like whatever, especially with cancer, like it's the people who you work out with, it's the people who, your physicians and your other health professional staff, but find that community. Don't try to do it alone. Use it as a time to really reach out and connect.
Yeah. So
And
is that
ask
what
for
you wish
help.
that people knew?
Yes,
Kind of?
yes, yeah.
Find your community.
Yeah, yep, and ask for help, which is hard, I think, is,
Yes.
you know, as moms, we're used, or women, so often, we're moms who are used to taking care of everyone else, and so luckily I have my two sisters and my parents here, and then my kids and my husband, but like, I think, yeah, ask for help and find your community, find your team.
All right.
Yay.
Well, I want to say thank you to Michelle for sharing your story. We'll be posting all October. We'll be posting different videos of Michelle. We've kind of been following her journey here through this, through the wellness place, through the cancer center here at the Harmony Campus, the UCHealth Harmony Campus here in Fort Collins. So we'll kind of share different pieces of her journey and different, people on your team, because it is a really cool approach here that they have with this wellness place. You can get acupuncture, massage, dietitian to talk to, physical therapy, exercises. So there's it's all here, and it's all available for someone that's going through their cancer journey. So we'll be sharing that all month of October. If you have any questions still or want to know more, you can post in the comments and I'll get those answered for you. But otherwise, we will sign off from here. Thank you so much for both of you and for everyone for joining us.